Hello, I'm Morgan Katz. I'm an assistant professor at Johns Hopkins Bayview, and I'm the director of antimicrobial stewardship at Bayview. I actually finished my fellowship here in 2017 and have been working on the faculty for the past 3 years. I actually became interested in infectious diseases in older adults during my fellowship. I had the opportunity to go to do some consulting at some surrounding nursing homes, and with some wonderful mentorship, I developed a lot of relationships there and helped guide them on some infection prevention and how to make infection prevention feasible in nursing homes. This has become more important in the time of COVID, and I've had a lot of wonderful opportunities and support from Hopkins to reach out and support nursing homes to prevent transmission of this infection through the nursing homes. It's my day-to-day is pretty interesting because I get to do a lot of different things. I work with so many different people and have had so many opportunities at Hopkins. Also want to introduce you to Dr. Fabre, who was also a fellow here and works in stewardship as well at downtown Johns Hopkins.
Thank you, Morgan. Yes, my name is Valeria Fabre, and as Morgan said, I was a fellow here. I think I was a year senior to you, Morgan, if I remember correctly. But as Morgan said, we work in a very supportive environment. We have great mentors that that help us, every day to accelerate our careers as junior faculty. I'm based at the Johns Hopkins Hospital, and I do stewardship and infection control work. The group is very strong, it's very productive, and we do a lot of cool things. I think my day-to-day as well is very interesting. I sit next to the infection preventionists, and it's always fascinating to help them resolve a TB case, or to support them in planning strategies to prevent hospital-acquired infections. And obviously, I'm very passionate about antimicrobial stewardship, and we are constantly developing quality improvement projects and research studies to optimize antibiotic use in at least in my main interest is in the hospital setting, but we have other faculty that are focused on the ambulatory setting. Morgan is our expert in the long-term care setting, and so I feel like we have a very robust program that covers many areas and settings.
Yeah, and you've been involved in making the Yellow Book, the antimicrobial stewardship guidelines, which really I distributed to all of my friends when I was in fellowship, because I wish that I had it during residency. It really saved my life.
Yeah, that's true. One of the main responsibilities of the stewardship team is to maintain the guidelines for antibiotic use up to date. This is going to be as Morgan was saying, the reference for clinicians to use antibiotics wisely. We get to do other very interesting things, such as looking at the antibiotic use data. We do that on a quarterly basis, or more frequently if needed, if we feel like there's a problem in a unit or with a specific group. If needed, we implement stewardship rounds so we can help the clinicians have a stewardship perspective for a period of time and until they improve, or if they're not improving, then we have to think about an alternative strategy to help them improve their antibiotic use. I think another interesting part of our work, which maybe as a resident or as a fellow you might not be exposed that much, is development of policies and hospital protocols, both for antibiotic use or for prevention of HAIs.
Yeah, I will say, I think one of the coolest parts about being at Hopkins is really, first of all, the collaboration between Bayview and downtown and getting to work with many different types of people, and also the collaboration with Bloomberg. I feel like no matter what I want to do and what interesting idea I have to do in the long-term care facilities, there's somebody that has some crazy lab technique that can test that out, or someone that I can reach out to. It really has provided sort of this huge network of experts in the field that we have access to at all times.
That's very true, actually, Morgan, because I've also had situations where I wanted to focus on something, and even if it was something that maybe like a direct mentor, wasn't able to, provide expert, support, like you're saying, that, we have a huge, network of people that we can connect with to, to pursue an idea. And so I feel like that has always been, we've always had the support from the fellowship program, leadership, to like pursue something that you're interested in, even though there might not be something that, someone is, directly working on within the group.
Mm-hmm. Yeah, I love that about being here. And when I came for fellowship here, I didn't know that I would stay for so long. And now I really can't see myself anywhere else. So it's just been so interesting. And the faculty are so supportive really across the board.
Yeah, and I have to say that even at a personal level, I think I've had a, very fun time with my family. I have 2 kids, and there are many areas that there's so many things to do, and that help you also balance, your work. And yeah.
Yeah, it's definitely a nice quality of life, and it's just cool to be in such a rich research environment, and with also such a diverse clinical community as well. So it's nice to have a job that you're doing, for me, a lot of different things in a day, because you're definitely never bored.
Absolutely.
All right. Well, thanks for having us, and
Yep.
talk to you later.
Thank you.